Hi, everyone. So today we're diving into a really crucial and, let's be honest, often unseen part of the surrogacy journey. We're talking about fertility injections. It's a topic that can bring up a lot of questions, maybe some anxiety, but it's also just a profound act of commitment. So let's break it all down.
I mean, it's a huge question, right? For so many people, the answer involves this incredible journey of hope and science and just profound generosity. It's a path that's filled with all kinds of emotions, and as we're about to see, some very specific, really courageous medical steps.
And for a surrogate, this is where that huge abstract question becomes incredibly real. You know, that whole monumental journey is built on these small, courageous daily actions. And a lot of the time, it begins right here with this one simple tool.
Okay, let's get into it. And there's really no sugarcoating it. For a lot of surrogates, the whole idea of daily self-injections can feel like the most intimidating part of the entire process. And you know what? That's completely understandable.
But here's the key thing to remember right from the get-go. That initial fear is totally normal, but it doesn't have to be permanent. This quote really gets to the heart of it, that anxiety can be turned into confidence. How? Through preparation and practice. It's all about empowerment. So how do we build that confidence? Well, it all starts with preparation. And this isn't just about, laying out your supplies. It's about creating a foundation of control and calm. Think of good prep as your secret weapon against stress. You can almost think of this as your daily ritual. First, get everything in one place so you're not scrambling. Wash your hands. It sounds simple, but it's vital for safety. Always, and I mean always, double check your medication and dosage. And here's a little pro tip. You can ice the area beforehand to numb it or warm the vial in your hands to make the liquid a little less thick. And crucially, rotate your injection sites. That's going to help prevent soreness and irritation. And honestly, this is just as important as any physical step. You do not have to do this in isolation. Having a partner, a friend, or even another surrogate there for support, even if it's just to talk you through it, can make all the difference in the world. All right, so our prep is done. Now it's time to focus on the how. This is where that practice really turns into a skill. It might seem a little clinical, but trust me, mastering this technique is a powerful feeling. Now, this is really interesting because there are two main types of injections. For an intramuscular or IM injection, you're usually aiming for the glute muscle. You go in at a straight 90-degree angle and you stretch the skin taut. But for a subcutaneous shot or subcut, you're going into the fatty tissue of the abdomen. For that one, you pinch the skin and use a 45-degree angle. So two very different goals and two very different techniques. And the process itself is just a series of calm, deliberate actions. First, you clean the site with an alcohol swab. Then, take that deep, grounding breath. Relaxing your muscles is so key here. Hold the syringe kind of like a dart, insert the needle confidently, and then inject the medication slowly and steadily. A slow pace often reduces discomfort. And finally, withdraw the needle quickly at the exact same angle you went in. Phew, you've done the hard part, but the process isn't quite over. What you do in the moments right after the injection is really crucial, both for your comfort and for helping your body absorb the medication effectively. Okay, first things first, safety. Dispose of that used needle immediately in a sharps container. If there's a little bleeding, just apply some light pressure with gauze. Now for the comfort part. Gently massaging the area or applying a warm compress can be a total game changer. This really helps the medication disperse into the muscle and can prevent those little lumps or knots from forming. So we've been really focused on the details, the day-to-day stuff. Now let's kind of zoom out and put all of these individual moments into the context of the entire journey. I mean, what does this all add up to? Well, for many surrogates, this daily routine of injections lasts for the first 8 to 12 weeks of the pregnancy. It's a significant commitment, for sure, but it's also a finite period of time. There's a light at the end of the tunnel, and it has a very clear purpose. And this quote just brilliantly illustrates that purpose. Every single one of those injections isn't just a medical task. It is a tangible, physical step forward. It is a marker of progress on this shared journey toward building a family for the intended parents. It's a temporary process with a permanent, absolutely beautiful outcome. All right, let's tackle some of the most common questions head on, because this is probably the number one thing on everyone's mind, right? The general consensus is that, while, yeah, there can be some discomfort, it's typically described as mild and pretty temporary. And remember all those preparation and aftercare steps we talked about? Icing the area, warming the medication, using relaxation techniques. Those are your best friends in managing any pain.
This is another one that causes a lot of anxiety. Life happens. So what happens if you just miss an injection?
Okay, the answer here is super simple and direct. Don't panic, but do act. Contact your fertility clinic right away. Timing is really important in these protocols, and they are the only ones who can give you the correct advice for your specific situation.
You know, when you look at this whole process, from that very first moment of fear all the way to mastering the technique, what you're really seeing is a journey of empowerment. It's about taking control of a challenging situation, building confidence, and just becoming stronger through knowledge and action.
And so we end with this thought. The journey of a surrogate, including every single one of these injections, is just this powerful testament to a timeless, fundamental goal. And it leaves us with a pretty big question. What modern challenges are we willing to overcome for the simple but profound act of creating a family?